I'm sure you've heard a lot of YouTubers say, don't get a Medicare Advantage plan because it's run by a for-profit insurance company and they'll deny your authorizations for treatment so they can fill their own pockets with money. Well, what most people won't tell you is that the Plan G, which is the thing that they're all selling, has one of the highest commissions in all of Medicare. So today, I am going to set the record straight and give you an unbiased look at Medicare Advantage prior authorizations. The unpopular truth is they're not actually intended to stop you from getting the care you need in order to save the insurance company money. They're actually just a way to keep people from abusing the system. And that's almost always how they're used. And when I say people abusing the system, it's not just the good people with Medicare. Sometimes it's bad actors or physicians or medical groups who want to bill Medicare for things that aren't even performed. So let me show you 4 reasons why prior authorizations are not actually scary. Number 1, every once in a while, you'll find someone who knows a friend who was wrongly denied care by their Medicare Advantage plan. You also hear this a lot from the Plan G salesman right here on YouTube. But have you ever met someone who was actually wrongly denied and never received the care that they needed? Probably not. The truth is, wrong denials are rare. Let's look at what the Kaiser Family Foundation says about this. 50 million prior authorization requests. 6.4% were denied, including claims denied for valid reasons. 11.7% of people appealed their denial. 81.7% of appeals resulted in the decision being overturned. Now, according to the Office of the Inspector General, 13% of prior authorization denials were wrongly denied. Now, certainly, you don't want to be one of those in the 13%. And that's not good. But that might sound like a lot. But if you do the math, that only adds up to about 9,000 wrong denials out of 50 million prior authorization requests. I'm not saying it's a perfect system, don't get me wrong. But that means that 1 out of 10,000 is your chance that your prior authorization will be wrongly denied. That's about as likely as getting struck by lightning in your lifetime. Yes, it does happen, but it's not nearly as often as these biased insurance agents would want you to believe. And here's why they're actually rare, because Medicare Advantage companies try very hard not to get these things wrong. And here's the proof. Every Medicare Advantage plan has a star rating from 1 to 5 stars. And this isn't some Google review star rating that just anybody can influence. Instead, the Centers for Medicare and Medicaid Services, or CMS, that oversees all of Medicare, they assign these star ratings to each plan. CMS has a strict criteria for rating these plans. There are 40 plus quality measures across all of these main areas of staying healthy, screenings, checkups, vaccine administration, managing chronic conditions, diabetes, blood pressure. There's member experience, like satisfaction and customer satisfaction. There are member complaints, how many people have called in and had issues or had problems. There's customer service, the responsiveness and appeal handling. Now, not only do the 5-star plans get more business, but if a star drops below 3 stars, CMS cuts funding to the plan, and that essentially kills the plan off. That's why Medicare Advantage plans will do anything and everything in their power to keep their star ratings up. Wrong denials can cause the Medicare Advantage plan to crash and literally go out of business. But okay, if an insurance company is so careful about incorrect denials, then why does it seem to happen all the time? It's probably because they're actually correct denials. Nobody wants to say this. There's all these hearings in Washington about prior authorization and everything, but there need to be denials. There needs to be a system for saying no. Because here's the truth. Most prior authorization denials are the fault of your doctor, not your insurance company. This may be a really unpopular thing to say, but after many, many years of experience with this, 15 years helping people with Medicare, I can tell you I've seen this over and over and over. A doctor's office submits something and says, hey, we need to do a knee replacement for this patient. And it goes to the carrier. The carrier is the insurance company. The insurance company looks at it and says, that's great. However, you submitted nothing. We don't know what the patient's condition is. We need you to submit your paperwork. Now, there was a lot of discussion in Washington recently about how we need to simplify that so that doctors can easily submit their notes and their explanation. But usually, that has not happened. And so almost every time that we have someone call us with a prior authorization issue, one of our clients, and says, hey, my doctor is trying to get this done and it keeps getting denied. We contact the plan, the insurance company, and we find out that they're willing to say yes. But they have no evidence of the need. They have no doctor's notes. They don't have the scan that was done. They can't verify any of those things. So you say, well, why do I want an insurance company to verify everything? because of fraud. We had the largest fraud scam in history that was just captured. These people were just figured out and stopped just a few months ago, totaling billions of dollars. There has to be a system where we can say no or where we can verify. What's the old phrase? Trust but verify. There has to be a system to verify. So what happens when you request a prior authorization? Well, the doctor submits the notes to the plan. The plan uses medical professionals, not financial professionals, uses medical professionals to determine if there is a medical need for that situation or not. Why would we want there to be that determination to be made? Because there are some patients, they sneeze and they go to WebMD and they Google sneeze and I didn't sleep well last night. And they find out, oh my gosh, I'm going to die, right? And they want to do everything. They rush to the ER. They want to have a CAT scan and a CT scan, and they want to have an MRI, and they want to do all these very expensive things, and there is no need for it because they just freaked out. You don't want to be the person that gets denied, but do you know someone, or do you have a neighbor down the street that you realize, oh my goodness, you know what? Someone needs to be able to check and make sure that what they're doing is not burdening the rest of us because we are all paying for it. When your neighbor down the street with Medicare has a procedure that was not necessary and the government pays for that, we all pay for that. So there needs to be a system for that. Now, when a doctor needs to submit a prior authorization, every service and every procedure that needs authorization comes with its own list of documentation, and the doctor needs to make that documentation. So here's an example that I have here from a health insurance company. And if you see this right here, it has the prior authorization list. On the second page, prior authorization list includes CPT codes. These are codes for procedures and for things that are billed to Medicare. So these codes, we won't know what all of these things are, but they will have prior authorizations. If we go down a couple pages to the prior authorization list, you'll see some of the common things. A CT scan, a PET scan, mental health services, Part B covered drugs. Part B covered drugs would be things like chemotherapy, mastectomy, bariatric surgery, arthroplasty. I mean, these are major things. And you can see that it says, for example, with a CT scan, we need the requesting physician's records and neurology records, other specialties as needed. For a PET scan, we need the requesting physician's records and the oncology records. So this has the outline of what's needed. If the provider, meaning the doctor, provides these things, then everything usually goes through swimmingly, no problem, because the doctor knows that you need it. If they're a legitimate good doctor, they just need to provide that to the insurance company so that the insurance company can verify that. That prevents fraud from happening because sometimes there are fake practices, fake doctors, or even some doctors that are pushing things that are unnecessary. And there has to be a check and a balance against even medical professionals. So we know doctors are usually super busy. So they either forget the requirements or they don't bother to go over them and they don't submit the proof that's needed. And when this happens, the insurance company rejects your prior authorization. And though you really need the services, it will be denied. And everyone gets frustrated and they're angry because the face of the denial is the insurance company. But the reason for the denial was the doctor's office. That's why 81.7% of appeals are overturned, because when it's appealed, proper documentation is then provided. So to avoid having to appeal your decision, it's a good idea to know what the requirements are and to make sure that your doctor is submitting those. So to summarize this whole prior authorization issue and to say something that is probably going to sound unpopular, most of the time the issue is at the doctor's office, not the insurance company. But why do so many YouTubers insist that Medicare Advantage plans are evil? Well, before I reveal to you YouTubers' dirty little secret, let me just jump in here first and say, if you're finding this helpful or interesting, then please hit the like button. And don't forget to subscribe, because we're one of the only channels that is committed to giving you 100% unbiased takes on Medicare. But all right, here's the dirty secret of most YouTubers who are talking about Medicare. They try to make prior authorizations sound super scary, not because they care about you. It's because they care about their wallets. Most people who bash Medicare Advantage here on YouTube are not even certified to sell Medicare Advantage. Medicare Advantage requires more certification to sell than Medicare supplements. It takes a long time to get certified every year for every insurance company to be able to represent Medicare Advantage plans. If they were certified to represent Medicare Advantage plans, then they're also not allowed to say that one plan is better than the other. That's a big tell. Since they're not licensed or certified to sell Medicare Advantage plans, they just push everyone into Medicare supplements instead. Medicare supplements can be great for some people, but it's not a one-size-fits-all solution. The people who bash Medicare Advantage, they push everyone to Medicare supplements. They're doing this because it gets them more commission. It also makes a YouTube video that's easy to share because it's incendiary. It gets people excited or upset. Some YouTubers even lie by saying that Medicare Advantage pays more commissions than Medicare supplements. They try to paint Medicare Advantage agents in a bad light. But in reality, the math is a lot more complicated. You can watch a full video that I did on commissions. But in a nutshell, Medicare supplements pay more upfront, while Medicare Advantage pays for a longer time. That's why people who just want to make a quick buck generally push Medicare supplements on everyone. But now you might be wondering, what about these real horror stories about prior authorizations that agents are talking about? Are they fake too? Well, unfortunately, there are horror stories that are not fake. They are extremely isolated cases, but there are people who have been harmed, who were denied care that they needed. And not only that, but Medicare is actively working to completely erase that 0.01% of prior authorizations that get wrongly denied. Just last June, RFK Jr. and Dr. Oz met with the major insurance companies to work through reforms on prior authorization. They want to standardize electronic prior authorizations. That would be a huge help for doctors. Reduce the amount of services that need prior authorizations by 2026. That's a good idea because you don't want to have prior authorizations on things that just a doctor should be able to order. They want to honor existing authorizations during the plan changes. They want to improve transparency in appeals and move to a real-time approval approach where you'd find out right away if something is approved or denied. That would use a lot of AI and other things to do that, and ensure clinical denials are reviewed by medical professionals. So don't let biased insurance agents here on YouTube scare you. Yes, prior authorizations sometimes can go wrong, and the denials can be dramatic, but that is extremely rare. And hopefully in the future, that will be taken care of for good. But remember, just because Medicare Advantage is not bad, doesn't necessarily mean it's the best for you. I've spent all of this time talking about prior authorizations of Medicare Advantage plans. And you might be thinking, oh, well, this guy, he just believes in Medicare Advantage. No, I believe in choosing what's right for you. And that means for some people, it's Medicare Advantage. For some people, it's Medicare Supplement. Did you know that 54% of people with Medicare have gone the Medicare Advantage route? And that approximately 18 to 20% have gone the Medicare Supplement route, and the rest have some other coverage with Medicare. That means that what's right for you is different than what's right for your neighbor. And what's right for you certainly isn't what someone is selling on YouTube when they're selling one angle, when they're only talking about one thing that's good and one thing that's bad. You need to look at all of your options and know what's best for you. So remember, you need to compare thoroughly Medicare Supplement and Medicare Advantage with no bias. And if you want to see a bias-free comparison, check out this video next.